For many children, teens, and adults across Southwest Connecticut, the challenges caused by the COVID-19 pandemic have brought many mental health issues front and center.
We see clients with anxiety, depression, children with ADHD, general challenges, a lot of school refusals. I'd say these things have been exacerbated since we're coming out of the pandemic, but not necessarily the issues changing per se.
That exacerbation is backed up by data from the Hub, a regional organization for 14 towns in Southwest Connecticut that coordinates resources for mental health. Before the pandemic, at least 10% of adults in our region said they felt completely or mostly anxious the day before. Rates of teen and young adult depression were up more than 50% compared to the prior 10 years.
It's no secret that kids are struggling with mental health issues before COVID, during COVID, and now coming out of it. I think we've seen an increase, I'm sure we've seen an increase in depression, anxiety.
For those seeking help, cost and availability of services can be a challenge.
People are also struggling where to go and seek help, and those who are seeking help are seeing longer wait times or struggling in finding providers who are within, their insurance networks or low cost, things like that. It's been a serious struggle.
And because many people are seeking services, providers say it's been a struggle to meet the need in the community.
So there is a huge lack of providers who speak different languages. We come from very diverse populations here. There's high Spanish speaking, Creole, French speaking, Portuguese, Polish, and it's hard to find those providers who are going to be available to everyone, especially at, a free or low cost.
Still, many providers are working to find ways to meet the demand, including tapping into federal and state funds.
We're really excited that we've identified early childhood as one of our priorities, specifically around how do we support our little ones with mental health services. So in Norwalk, we will be using some of our American Rescue Plan Act funding to fund mental health providers to support our early learning centers.
Others are continuing their work, expanding programs where they can.
We have 9 school-based health centers, all of which offer mental health services. 5 of them offer medical, licensed medical. So in essence, they're sort of independent clinics on site at schools. So it's really a great model that we can reach kids where they're at.
Our behavioral health department has 3 different departments within it. One is outpatient behavioral health, which is a small mental health clinic, traditional individual and family therapy, with also a group. We have a women's group for trauma survivors. And we have ICAPS, which is intensive in-home child and adolescent psychiatric services.
Providers encourage people struggling to reach out because many are working to make resources available.
We break them down by towns. This one is specifically the Greenwich, Stamford, Norwalk, and surrounding areas. As you can see here, we have things if you're in a media crisis or an addiction crisis. We have, if you go on our website, these are all hyperlinked, but we have the names and numbers.
We have what is called the Community Resource Hub. But you'll have a live person who is a community resource specialist. Give them a call. They're trained to help. They're trained to help you identify what are those resources that you may be entitled to, that you may be eligible for, or just resources that you may want to consider to get those support services. And we're happy to help and kind of walk you through that journey to get in the services that you need. My message is to our residents is you don't have to do it alone.
Reporting for Coastal Connecticut Times, I'm Kelly Prinz.